Welcome to the Quran Medical Clinic Research Therapeutic Project. Here we seek to provide simple, safe, and accessible solutions for brain and body health using the Holy Quran as stimulus with a scientific and empirical approach. The main goal of the Quran Medical Clinic is to make treatment accessible to everyone. We want to make powerful neuromodulation tools, previously only available in specialized clinics, available to everyone in the simplest and most practical way possible. Conventional neural stimulation uses simple patterns such as sine waves, pulses, or randomized noise, but our brains have evolved to process complex and dynamic signals such as speech. In this project, we use these patterns optimized by nature to interact more effectively with the brain and stimulate the neural network. Instead of using direct electrical stimulation that requires special devices, we use the body's natural pathway in this innovative method. Here, your mobile phone becomes a nerve stimulation device by vibrating, activating sensory receptors on the tongue and skin to send signals indirectly and safely to the brain. To perform this method, simply cover your mobile phone with a clean cover or place it in a clean freezer bag. Then play the audio file we provide you with at maximum volume and place the phone speaker in contact with the tip of your tongue, so that the outlet is neither completely blocked nor far away. It is enough to be tangential to the audio outlet. Additionally, your lips can be in contact with the body of the phone and you can place the end of the phone on your teeth. This way, you will feel the maximum vibration. To stimulate the vagus nerve, play the audio file we provided at maximum volume. Place the audio output of the phone on the neck in the area where the pulse is felt or below the angle of the jaw. It is better to place it on the right side of the neck and parallel to the trachea. The neck should be relaxed and its muscles should not be tense. Do not press the mobile phone too much on the carotid sheath, as this can cause pressure drop, lightheadedness, or nausea. In the early stages, it is better for people with heart problems, low blood pressure, or sensitivity in the carotid area not to undergo this procedure. With this multisensory stimulation, we perform network stimulation of the central nervous system, which causes neural coordination in the complex network of the brain and viscera. To understand the principles and mechanisms of action of these methods in more detail, I recommend that you read the basic principles file. I hope that you can improve your physical and mental health with the methods I mentioned. In the studies we conducted with electrical stimulation, the initial qualitative results showed favorable performance in improving symptoms of digestive diseases such as constipation and irritable bowel syndrome, nausea, gynecological diseases such as dysmenorrhea or painful menstruation, lack of menstruation or amenorrhea, chronic and tension headaches, and even in some cases cardiac arrhythmia. It seems that in the future we will witness a wider range of functions of this method, and it is very promising. Seeing these results in electrical stimulation, we were encouraged to make more efforts to provide a universal and free method by introducing vibroacoustic stimulation. In this path, your support and participation in testing and reporting the results can be very effective in stabilizing and helping all people with similar problems. I need to explain that you must choose only one method, namely, vibration stimulation of the tongue with a mobile phone, or only stimulation of the vagus nerve in the neck, or visual auditory stimulation, which I will explain later. In addition, you must use this stimulus with a specific order, so that you can use it once, twice, or at most 3 times a day, and you must maintain the same order until the end. For example, it should not be once one day and 3 times the next day. We have considered the minimum treatment period to be 3 weeks, which can vary depending on the severity and nature of the disease. To join us in helping others, you need to complete 3 questionnaires so that we can know the effectiveness and also give your suggestions or criticisms. There is a basic information form where you create your own unique code and you can remain anonymous. In this form, you state basic information such as age or disease status and medication use. The next form is a weekly report form that needs to be completed once before starting treatment and then every week. In this form, you only write the unique code you created first and answer the questions, and the third form is related to the report of each stimulation session that you complete before and after the session. These questionnaires are simple and shortened, and it takes very little time to complete and does not cost anything, but it can be of great help to all people and reduce the medical costs of society, so your cooperation is valuable. Do not underestimate it. In addition, I will include a summary questionnaire for some diseases that you can complete if it is related to your disease. The most important ones are the 3 forms I mentioned first. In addition, I will include a separate form for suggestions or reports on specific diseases that you think need further explanation. To view these forms and the scientific and theoretical foundations of this therapeutic research project, you can access and study the necessary information from the link I will post on the channel. Thank you for your support. Goodbye.